everybody. Thank you for joining again today. My name is Dr. Zipporah Brown and I'm an occupational therapist. For those of you who may be unfamiliar with the term occupational therapy, in short, we help people live life to the fullest or their best lives. I will have a video coming up soon in regards to what occupational therapy is in depth and the different practice settings that we work in. However, today I want to talk to you all about stress and anxiety. So starting out, I want to define stress, define anxiety, thinking about its origins, signs and symptoms, and some ways to cope with it. So let's start out with imagining you are in nature, camping with family and friends at Yosemite Park like you do every year, and you decide to venture off and explore nature in all its beauty. And as you head back to the campgrounds, you are faced with a fierce bear that appears angry and ready to attack. So at this point, you may be thinking, oh, right? And so a small piece of your brain called the amygdala kicks in, and thank goodness. So you have the choice to either fight, flee, or freeze. This is what's called your stress response, and this is activated through the sympathetic system. This is a very beneficial and healthy response when you're in a life or death situation. However, this is an unhealthy response if you're in traffic or receiving emails or experiencing things that are not life-threatening. So when we are not able to act out our primitive instincts, right, being able to fight, flee, or freeze, and we internally negatively respond to these things, that is where anxiety comes from. So stress is an external response to a threatening situation, and anxiety is an internal response to not acting out stress appropriately, okay? And so with that being said, stress and anxiety do have similar signs and symptoms. These signs can be broken down into 4 categories. These 4 categories consist of feelings, behaviors, thoughts, and physiological or biological, your physical responses. So in thinking about the symptoms that are categorized as feelings, this consists of depression, fear of failure, frustration, guilt, hypersensitivity, restlessness, tension, or the urge to laugh or cry in inappropriate times. And in terms of behaviors, one can be more likely to be accident prone, have a change in social patterns or become avoidant, impulsive, so acting without thinking, procrastinating or avoiding assignments or tasks, sighing frequently, difficulty sleeping, jaw clenching or biting, nail biting, and pacing. And in terms of thoughts, one may feel self-criticism, have poor judgment, the desire to escape or run away, forgetfulness, indecisiveness, preoccupation, repetitive or negative thoughts, and difficulty concentrating. So overall, an effect on cognition. And in terms of biological or physical signs and symptoms, one may experience tight muscles, back and neck pain, fatigue, a pounding heart, trembling, cold or sweaty hands, rapid breathing or shortness of breath, dry mouth, headaches, blurred vision, an upset stomach, chest tightness, or dizziness. So these signs and symptoms could appear the same for stress or anxiety, but again, keep in mind the origin is what is different. So now that we've talked about stress, anxiety, their definitions and their origins, and how the stress response is released, let's talk about counteracting that from a wellness perspective. And so, wellness is a conscious, self directed, and evolving process of achieving one's full potential. So, we can counteract stress and anxiety by activating what's called the parasympathetic system or the relaxation response. And so, the relaxation response is the quickest way to counteract our body's reaction to stress or anxiety. And we can do this a number of ways through what are called coping strategies. The easiest way to elicit or activate the relaxation response is through deep breathing. And deep breathing holds many different forms. One of the easier ways to elicit deep breathing is by inhaling for 4 seconds, holding for 2 seconds, and exhaling for 6 seconds. Other ways to elicit or activate our parasympathetic system is through progressive muscle relaxation, which consists of tensing and relaxing different muscles in our body to release tension. Imagery and visualization, so this is imagining or visualizing a positive scenario or a situation that brought joy. By doing this, we are actually firing the neurons in our brain that would fire if we were actually experiencing that positive experience. Other ways to activate the parasympathetic system would be through meditation, gratitude affirmations or journaling, getting some sunshine or vitamin D, sitting outside, as well as creative pursuits. So this can be engaging in arts and crafts, learning a new instrument, dancing, anything that is eliciting some sort of creative pursuit. And then lastly, physical activity. So physical activity actually releases the stress hormone, which is what our body's primitive instinct would be to do. Remember, if we think back to the sympathetic reaction being to fight, flee, or freeze. So these are not a full list of some ways to activate the parasympathetic response, but just a few different coping strategies that can help with experiencing anxiety. So just to wrap up, stress is an external response to a threatening event, whereas anxiety is our body's internal negative response to stress. So although they have the same or similar signs and symptoms, their origins are different, and they can appear to be the same, but keep in mind stress is a normal reaction, whereas anxiety is us internalizing it. So I hope this was helpful. Please leave comments, tell me your thoughts. Let me know if there are any other topics you would like me to cover. It has been my absolute pleasure. Again, my name is Dr. Zipporah Brown, and I'm an occupational therapist. Take care.